Hi and welcome to Wirsttraining. In between the exercises I'm going to read something about the Ehlers Danlos Syndrome, and participating in the exercises is your own risk. And the Ehlers Danlos Syndrome is a disease, or are diseases, and I'm going to spend the rest of the video talking about symptoms of this disease. Let's start with the first exercise. So we're having good aligned shoulders and the arm comfortably at the side. And the hand is formed to a fist and we are bringing that fist down. And again up. And down. And up. We're going always as far as we can go with a bit of effort. And as soon as we have reached the point which we can reach with a bit of effort, we're turning slowly around and going into the other direction towards another better. So here with the other arm, we are going upwards as far as we can go, and then we're turning around and are going into the other direction as far as we can go with a bit of effort. And now, the last time. Now to the Ehlers Danlos Syndrome. Connective tissues are in the human body, so inside of this human body there is connective tissue. Connective tissues are in many different parts of the body, and there are different types of connective tissue. So not every connective tissue is the same, and it is in a whole lot of different parts of the human body. One type is cartilage in the joints, helping to absorb impacts. Tendons are connective tissue because they attach muscles to the bones. There are connective tissues carrying and distributing immune cells. Connective tissue is around many organs, separating them from other things. Even bones, which consists out of cells, fibers, and something called ground substance, and blood, which delivers oxygen to all body parts, consists out of cells and plasma, are connective tissues. So connective tissues is a very broad term. Even bones are connective tissues. Blood carrying oxygen to the whole body is a connective tissue. Tendons are a connective tissues. Connective tissue is between the organs to separate them. There's something which are transporting carrying and distributing immune cells. So it's over the whole body. A different part of even cartilage is connective tissue. So connective tissues are everywhere in the whole body and connecting everything everywhere. The next exercise. We're having both hands with fists on the outside, and now we are returning these hands to the inside, and now these fists to the outside, and to the inside, and to the outside. And if there's pain anywhere, then immediately stop. So this should not be done if you feel pain anywhere. And we're going with a little bit of effort to the inside, and to the outside. Last exercise was the spotlight, and this is the flashlight. And to the inside, and the last time to the outside and back to the inside. So connective tissue is all over the human body. It separates organs. It is also tendons. It are muscles. It are bones. It is blood. Blood is a fluid connective tissue. Cartilage, and so on. Now, connective tissues can have disorders, and 14 different disorders are declared as part of the Ehlers Danlos Syndrome. So, there can be a disorder with a connective tissue. And this Ehlers Danlos Syndrome is a group of 14 different disorders of the connective tissue. So, the Ehlers Danlos Syndrome are a group of 14 different connective tissue disorders. Next exercise, the magician. Both hands with flat hands beside us. Now we're turning these flat hands to the inside and to the outside. And we're going slowly, as far as we can go with a little bit of effort, to the outside. And now with a little bit of effort, as far as we can go to the inside. And inside. And to the outside, and again to the inside, and the last time to the outside, and back into the inside. So, Ehlers Danlos Syndrome are 14 different disorders with connective tissue, which is everywhere in the human body connecting everything. genetic disorders are present even before birth. The 14 connective tissue disorders of the Ehlers Danlos Syndrome are genetic. That means that the cause of the disorders existed already before birth. So they don't come through an accident or something during life, or through a disease or an effect or anything. They are present before birth. They are genetic. The problem, the disorder, is in the genome. And all 14 of these connective tissue diseases of the Ehlers Danlos Syndrome are genetic. The disorder, the problem with the genome happens before birth. The problem is in the genome. Next exercise. Now the pancake flipper. And we are having both hands, flat hands beside us. Turn with the palms to the floor. Now we're turning these palms to the sky. And back to the floor. And we're going as far up slowly as we can turn to the sky. And as soon as we've reached the whole point, we're turning slowly around. We're going into the other direction as far as we can go. And a few times more. And now for the last time. The 14 connective tissue disorders of the Ehlers Danlos Syndrome, Danlos Syndrome are genetic. They are present. These disorders are in the genome even before birth. Symptoms of the 14 genetic connective tissue disorders of Ehlers Danlos Syndrome are loose joints, stretchy velvet skin, abnormal scar formation, and joint pain. So loose joints, the joints are loose, the skin is stretchy and velvety, and abnormal scar formation happens, so the scars are healing in an abnormal way, however that would be described. What is here told? And joint pain, so pain at the joints. And the next exercise, it is already the T-Rex in the morning. So we're stretching both hands out, the flat hands, and we're bringing these hands down. And again up. And we're going slowly, as far as we can go, down and up. And again down, up. And we're going to do this now for the last time. And that is what T-Rex in the morning. So the Ehlers Danlos Syndrome are 14 different genetic connective tissue disorders, and the symptoms are loose joints, stretchy and velvety skin, and abnormal scar formation and joint pain. The 14 connective tissue disorders of the Ehlers Danlos Syndrome can cause complications like aortic dissection, blood flows between the layers of the aorta. So the aorta, there can be, by an aortic dissection, the blood flows between the layers of the aorta, which is not good. And joint dislocation, by joint dislocation, the bones are out of the socket in which they are in. So they are not there in the joint where they should be, but they are out of it. This is also not good. And scoliosis. Scoliosis is, it's written here, is a C or S formed spine. So the spine is basically straight. It has both to the third, then to the back and the lower back and then the table. But it's basically straight, seen from behind. And by scoliosis, it is C-shaped or S-shaped. And chronic pain is also not good. Chronic pain is a pain which consists longer than 3 months, and it's not just through a cause like stubbing a toe or something, but it's chronic and it stays over a long time. It is not good. And osteoarthritis, the cartilage at the joints is decreasing, and that causes stiffness in the joints, so the fingers can't be bent properly, and they ache and cause pain, even if not bended oftentimes. The causes of Ehlers Danlos Syndrome are yet unknown, but it has something to do with mutations in the one or more of 19 known genes. So the causes of these 40 different genetic Ehlers Danlos Syndromes, connective tissue disorders, are unknown, but they have something to do with disorders in 19 genes which we know of. And the next exercise, it is the T-Rex syndrome. So we're having a tennis ball. If we don't have one, just use my fist. And I'm taking the tennis ball like this with 4 fingers. The thumb is basically nothing doing. And we're having a flat line from the knuckles to the elbow. And now we are pressing. Moderate force, don't overdo it. And releasing again. And we are releasing. And releasing again. And we are pressing. And changing. And we are pressing. Releasing. And pressing. And releasing. And the last time a bit longer, pressing. And it was a T-Rex. No cure is known. Ehlers Danlos Syndrome is often misdiagnosed. Treatment tries for physical therapy to strengthen muscles, bracing to support joints. So there's no cure known, but treatment tries to strengthen muscles and to support the joints, maybe even through bracing. And I can't say much to bracing. I don't know much about bracing. If blood vessels are affected by the 14 genetic connective tissue disorders of Ehlers Danlos syndrome, life expectancy is decreased. So if the blood vessels, like by the aortic dissection, are affected, then it can decrease life expectancy. HEDS is the most common type, for which ours and for the others one, no genetic tests exist. And now to the cautious big bang. We're placing the fingertips of one hand on top of the fingernails of the other one, and we are opening that hand with a resistance against that hand. So that hand's pressing, and that hand tries to open and then close again under force, with resistance to that hand. So the most common type of Ehlers Danlos syndrome, of these 14 genetic connective tissue disorders, is HEDS. HEDS, the H is written small for some reason, and now we're changing. And for that one, for the other ones, there is no genetic test available. So for the most common type of this often misdiagnosed disorder, there is no genetic test, and the diagnosed book is made up with symptoms. It's made with, not made up, made with. The genes known to cause Ehlers Danlos syndrome have to do with the structure, production, and procession of collagen. Collagen is it with which provides structure and strength to the connective tissue. And the last, no, not the last one, we have one more. So the hands out, the fist, and the fists towards each other. So these genes, these genes which are affected by the disorder have something to do with the production and the structure of the fibers, of a collagen. And collagen is important to give structure and strength to the connective tissue. And to the inside, and now to the last exercise. And we're turning the fist down and pressing with moderate force against the index finger. And the last point on that list, not from the outside, the last point on that list is that the frequency of these disorders, these 14 different disorders, is 1 in 5,000. And from the bottom. And now we're turning the fist down and we're pressing slightly against it. And from the outside. And from the top. And from the bottom. And now we're going with the fingers out of the middle part of the lower arm. So, Ehlers Danlos syndrome are 14 genetic connective tissue disorders. Connective tissue is everywhere overall in the body. And there can be complications like aortic dissection, joint pain, and so on, osteoarthritis, and it's hard to diagnose. The frequency is 1 to 5,000 people have this, and it's inborn, it's genetic, and there are, I think it were 19 known genes which cause this problem with the structure and production of collagen, which is important for the strength and structure of connective tissue. Thank you very much, and until next time.